Well, it's something Australian GPs are seeing more of. Physically healthy women in their 20s and 30s experiencing intense pain in their chest and down one arm. Classic symptoms of a heart attack. But after a series of medical tests, some have been surprised to find out the cause of the pain wasn't physical, but from stress and anxiety. So Dr. Tamara Hunter joins us to talk us through the dangers of stress. Hi there, Dr. Hunter.
Hi, Amy.
Now, how much more common has this become, and is it just a symptom of modern day living?
Well, stress is a very emotional and physical response to external triggers and environmental stressors, and we all respond differently to different environmental triggers. Some people get stressed by public speaking. Fear of heights can sometimes make people stressed and others not. So it's very, very individual. In 2015, the Australian Psychological Society did a survey and actually found that 26% of Australians are reporting higher than normal anxiety levels, and in fact anxiety as a whole is expressed far more than it was over the previous 5 years of surveys. So we are seeing a higher amount of anxiety and stress. A lot of people report that financial issues are a big cause. 1 in 2 people report that. Conflict with family and friends, also experiencing negative health issues in themselves and their families can also cause stress and anxiety. And interestingly, social media has reared its ugly head, particularly with the FOMO phenomenon, people having a fear of missing out causing great stress and anxiety.
Yeah, it sounds like there's a lot of stress out there. What are other physical symptoms that, can be caused by stress, and just how dangerous can it be?
Well, stress is a very physiological response in all of us. We call it the stress or fight and flight response, and we all experience it in response to different triggers. So our blood pressure goes up, our heart rate goes up, our respiratory rate goes up, so we can have palpitations and hyperventilation. Blood sugars go up, blood pressure goes up, our muscles can become quite tense, particularly around the head and the neck. And so that's a very common stress response by all. Now, if people have an underlying medical condition that can get tipped over the edge by that, such as cardiovascular disease, that can manifest as angina or even a heart attack. So it's really important to go and see your healthcare practitioner, make sure there's nothing pathological underlying your symptoms.
So how are you going to know yourself if it's stress related or actually physical, or is it really just about talking to your GP?
I think it's really important, if you're experiencing it for the first time, to rule out any pathological causes. And if nothing is found, then it is not uncommon for it to be a symptom of anxiety. We don't exactly know why it happens, and a lot of things have been blamed. Esophageal spasm, spasming of the muscles in the chest wall, erratic breathing has even been attributed to chest pain, and even an acute rise in blood pressure is thought to possibly cause chest pain as well.
Okay. It has become common to use medication to manage stress and anxiety. Are there other tools that we can use before we sort of default to, I guess, the pharmaceutical companies?
I think it's really important to talk to your healthcare practitioner, particularly if you're finding it difficult to cope with everyday daily activities. So anti-anxiolytic medications are part of the process, but they're not the only management. Cognitive behavioural therapy, relaxation techniques, sitting down with a psychologist and working through those techniques. But things that we can do on a daily basis, spending time with friends and family, getting plenty of sleep, exercise, sometimes reading and listening to music is really important. And I always think that time management techniques are really key to managing stress and anxiety.
And maybe just a bit of chocolate. It is
definitely.
International Chocolate
Week. In medicinal amounts, Emmy, for sure.
Oh, I like the thought of that. Dr. Hunter, thanks very much for your time this afternoon. Have a great weekend.
Yes, you too.